Welcome to Status, a game-changing product for electronic medical records management and patient engagement. We will now take you through some of the application's main functionalities. In Status, there are a number of areas which are available to all users and can be made accessible to the general public without the need for any credentials. One of them is Healthcare Provider Presentation page, complete with a general description, contact details, and location information. It may also include quick links to mobile apps and other publicly available resources. You can easily apply filters to find nearby clinics based on your location. The filters can be applied by name, medical specialty, country, city, and distance. You can then see the list of the associated medical personnel for each medical center. The general public can also check doctor and medical staff information, which may include professional experience, schedule, assistance, and feedback from patients. With Status, it is also possible to make online appointments. Just search for your desired specialty, medic, or location. Select one of the free time slots marked in the calendar with green. Input any other relevant information, and you are done. Let's see a typical flow for a patient. After login, the application takes us to the patient profile. Here, you can find an overview of the main medical parameters like blood type, body mass index, blood pressure, and general information about a patient's medical history, family history, allergies, and any other relevant information that may affect current or future health. To add new information, simply click on the Add Information Category button or click on the existing category name. Input your text and decide its visibility. If you check the Emergency Information category, then the information becomes available in the Emergency tab. Information in the Emergency Information tab is visible to all doctors and medical staff with a Status account. Any type of document, data, or record can be included in the Emergency tab. The medical record is core to Status. Here are documents and medical investigations, including X-rays, CTs, MRIs, photos, and video recordings are consolidated. Also, it is possible to add medical events. Where possible, Status automatically creates thumbnails of the records for easy navigation and identification. For records created by the current user, you can edit their information and change access rights. Other visible records can only be downloaded or accessed for attached information. Finally, you can select multiple records and use them to create a collection of documents for sharing with other Status users or even with users outside Status based on their email address. A collection can always be edited later, including its content, who is being shared with, and access rights on documents. Displaying health parameter evolution is another core feature of Status. Status maintains a list of all parameters with their respective medical values. Consulting one of these parameters gives all their available information, including historic values, graphic evolution, and the source of the information. Using the Health Sets functionality, you can view and assess direct correlation between different medical parameters to better monitor your health condition. To improve health services and treatment effectiveness, Status employs its own medication management system. The web application works with the mobile apps provided by Status. The mobile apps deliver notifications for medication intake and feedback on treatment compliance, which can be viewed as a timeline. As a patient or doctor, you can view the medication history, current treatment, make changes to it, add a new medication, or completely change your current treatment. As a patient, you can schedule your medication hours based on your doctor's recommendations. My Doctor's section displays the history of medical interactions and current availability for voice and video calls. You can even start a conversation or initiate a live consultation. With the System Checker, you can receive quick guidance for choosing the appropriate medical specialty and save precious time during appointments. On My Appointments tab, you can easily view a list of the current made appointments, and in Consultations tab, you can access previous consultations together with the associated medical notes. If the patient is logged in and has been treated by the doctor, he or she may leave a feedback. Which later needs to be approved by the doctor or healthcare provider in order to become visible to everyone else. My Insurance tab gives you access to both active and inactive healthcare insurance policies, with the possibility to view the details for each policy and to download the associated documents. In the Next tab, you can view the current dependents associated with your existing account. You have full control to manage their profile. Status offers also the possibility to view and submit reimbursements for previous consultations as agreed with your insurance company and the healthcare provider. For increased efficiency, you can attach documents directly from your medical records available in Status. The following tab provides you an entire set of benefits, promotions, and offering from healthcare centers, insurance companies, or other service providers. In the Information Center, you can find descriptions of additional services available from healthcare providers or download useful forms. Following your given prescription and based on your current location, you can view a list of pharmacies, see their position on the map, and access additional information. Status comes with its own built-in messaging systems, available both in the browser and in the mobile app. Users can communicate with ease, get notified when new messages arrive, have a history of all conversations, and can easily check the profile of whom they are talking with. Finally, Status has a system for generating automatic notifications based on system events or administrator settings. Notifications can be configured to be received online, via email, or delivered to mobile devices. This concludes our presentation for most of the core functionalities that patients have access to. Next, we will discuss functionalities which are available only to doctors. Just like all users in Status, doctors access the application using their credentials. Access to different areas of the application is based on roles attributed to each user. By default, the application is set to take doctors to their consultation dashboard. Here, they can view the patients which are currently waiting in their office and quickly access their medical file. In the bottom half of the screen, doctors can view patients waiting for consultation and the duration in minutes since they have arrived in the clinic. To close an ongoing patient visit, simply click on the flag next to their name and add any relevant information if necessary. Doctors have a number of areas which are only available to them, such as treatment schemes, patient search, and doctor profile. Doctors can view and edit their profile and add any other information they consider relevant for their professional experience. They can also edit their schedule and add out-of-office time. View and approve feedback comments from patients. View their appointment history and patient visits. For ease of use, Status allows doctors to create treatment schemes. Adding a treatment scheme to a patient's medication automatically inserts the new medication with its timetable and dosages to the patient's existing treatment. Treatment schemes can also be made public and shared between doctors. Finally, let's see the doctor's view of a patient's medical file. Not all doctors can view a patient's medical file. Only those who are connected to the patient can access all information. Everyone else can only view the emergency information. A doctor is connected to a patient either manually by the reception desk or automatically the first time when the patient is confirmed to have arrived for a visit. You may notice that the medical record has a number of different records when viewed as a doctor. This is because of security and access rules, which control the access level for every user in the system. These are just some of the core features of Status. Apart from them, the application offers many other functionalities like a reception desk dashboard through which you can control, schedule, and manage current patient visits and appointments calendar. A specific area for management with reports on staff performance and business efficiency. A user-friendly interface where system administrators can configure advanced settings in the application. Status, a modern healthcare solution for electronic medical records management and patient engagement, offering a better way to enable doctors and other medical services providers' staff to interact with patients in a secure and friendly environment and deliver the next generation of personalized healthcare. Status fosters team collaboration and efficiency to provide better and personalized healthcare services at lower costs while improving the overall patient experience and engagement. If you would like to learn more about Status, please visit us at www.status-online.com. This concludes our short presentation. We hope you've enjoyed it. Status. Better healthcare services, better life.